My name is Dr. G. Welcome to That's Unusual, my podcast uncovering the unusual stories behind the world's most interesting people. On this show, we celebrate what makes us different and how we convert those differences into unexpected opportunities. Hey everyone, I can't believe it, but it's been almost a year since I started my podcast, That's Unusual, and what an incredible experience it's been. Thank you to all of my listeners and subscribers that have been out there. I'm actually going to be winding down the podcast over the next couple of weeks. But fear not, I'm actually going to be bringing back and creating a brand new podcast that I think is going to be much more exciting and a big improvement from the existing one. I've learned a lot along the way, but we will have incredible guests with more storytelling, but really in a new format built around and organized themes and seasons. I don't yet have a name for the podcast series or a release date, but probably sometime in the fall or winter. But you can always stay informed by signing up for future updates by going to where&nbsp.com and just enter your email there, and you will be the first to be notified when I do release that new podcast. So again, a big thank you for all of those who have stayed with me and have listened to my podcast. I've learned a lot from you, and I look forward to bringing back something even better down the road, coming soon. So with that, let's go ahead and get started with the introduction of today's episode. Almost 2 decades ago, Michael ONeil lay on a hospital bed awaiting chemotherapy, having just recently been informed he was diagnosed with non-Hodgkins lymphoma. He had more questions than he had answers, and had no idea where to turn at the bedside to get informed and be engaged. That was the genesis for his rapidly growing and global company called Get Well Network, designed to educate, inform, and engage the patient throughout the course of their medical management. At a time when Google was just an infant, Facebook had not been conceived, and smartphones were just a futuristic vision, Michael chartered into unknown territory and not only beat the odds in defeating his cancer, but also grew Get Well Network into a behemoth of a company, busting through walls as a pioneer in the patient engagement space. On this episode, Michael shares it all, from how his experience of being diagnosed with cancer prompted the idea for Get Well Network, to the hurdles he had to overcome along the way, to where he believes the market has evolved over the past 20 years. As you listen to this episode, I ask that you reflect on your own unusual stories and unique qualities that can help open doors to unexpected opportunities. And so with that, let's get started. Welcome to another episode of That's Unusual. I'm excited to have my guest with me today, Michael ONeil. Welcome to the show, Michael.
Hey, thanks for having me.
So you and I have known each other for quite some time, and you were a guest lecturer in one of my courses that I taught over at Johns Hopkins, and I've always just been fascinated about your journey and your story. And I think the listeners will probably be fascinated as well. Actually, I'm quite certain that they will. But before we get into some of that, maybe for those who aren't familiar with Get Well Network, perhaps you can just give us a couple of sentences how you would describe what Get Well Network does.
Sure, but first of all, the fact that we did a class together and you're still talking to me is a testament to our friendship. So I appreciate it.
That's right.
But yes, listen, Get Well Network is really focused on, I guess, a singular thing, and that is helping people live their best lives by taking an active role in their health journey. And so we work with healthcare providers here in the U.S. and abroad in helping them create a more patient-centered care experience to really drive, frankly, a better outcome, for what they're trying to do with their patients.
Yeah. And, most people probably, if they haven't heard of the name Get Well Network, I'd imagine if you've been in any hospital facility or healthcare facility, you've probably interacted with one of your technology platforms or content at some point, even though they may not recognize the name Get Well Network. So you're certainly, seeing the growth over the course of the years has been astounding. But what really fascinates me is the fact that you created Get Well Network out of a personal experience that you had. I believe it was in the late 90s. Is that correct?
It was actually 1999. So I guess, sometimes we choose industries and careers, and sometimes in some ways, I guess they choose us. And so I was literally in the middle of my graduate work at Georgetown in Washington, D.C. I was studying for a JD MBA and was diagnosed with non-Hodgkins lymphoma. And so I spent more time than you'd want to as a 28-year-old cancer patient, was treated up at Johns Hopkins in Baltimore. and had a bunch of surgery to cut about half my stomach out to remove a tumor. And then I went through 4 cycles of what they call CHOP chemotherapy. It's a very traditional and very aggressive regimen of chemo. And so through my treatment, really had one of these wonderful medical outcomes, but really had an experience as a patient and family that was, less than what we wanted it to be, to feel as empowered and as enlightened and as in control as we wanted to be. So really kind of then began to think about a different way to spend my life, if you will.
Yeah. And so walk us through what that experience was like, because, you were sort of, it was a little bit of a surprise diagnosis, and you were sort of, thrust into trying to get smart on a condition that a lot of people just don't know about. So what was that experience like, and what were you trying to fix as a result of it?
Yeah, it's just going to sound kind of crazy and very mundane, but, back in the day when you were a hospital patient, so I was there for 11 days recovering from surgery, waiting for the pathology to actually come back. And during this time, I had indications from my surgeon it was likely cancer. So the anxiety kind of begins to build, and your family starts to fly in from all over the place, and your mom's hysterical. And I'd just been engaged for 3 months, so it wasn't so easy on my bride to be either. And so as this thing began to build, you are clamoring to understand, what is going on? What does CHOP chemotherapy even mean? If I have to go through it, what is all this stuff happening? And so, in this time, it sounds crazy, but one thing that I would want is my doctor to come in at the same time every morning to explain to me what was happening. And that would never happen because they're very busy. You never know when they're coming. But what I did know is every morning at about 9 a.m., a kid would come around and ask me for $6 to turn my television on in my room. And so like clockwork, quite literally, I actually would fish up the money or ask my law school roommate to give me some cash. And he turned his TV on. There were about 12 staticky channels on it. And so I would have to channel all up around to kind of see what I wanted to see. And at one point I asked the nurse, hey, listen, I'm really trying to figure out, what this cancer and chemotherapy thing and radiation is kind of all about. She said, oh, well, we have an education channel on channel 11. And so I channel all up around the whole thing. And when I get there, there's literally a breastfeeding video. I'm like, are you kidding me? So I'm literally we're living in a world back then where you started to have access to any information you ever wanted at your fingertips through your phone and through your laptop or what have you. And when you come into a hospital as a healthcare patient, all of a sudden that was completely had gone away. And so this was a kind of ridiculous, but a real impetus for me to say, what if we actually were to, bring that power of information into the patient's hands at a time where he or she needed it the most? And might that have an impact, on the safety, quality, and service, and ultimately the outcome of care? And so that really is what kind of began us really drawing out on some napkins, if you will. What if we actually just converted these kind of old technologies like TVs, made them desktops, and started to treat people really personally with information that they actually may want at the point of care?
It makes great sense. And if those listening can even just remember what it was like in 1999, right? I mean, I was in medical training at that time. And, this is, Google had just been started up. None of the social networks and things existed. We didn't have the smartphones in our hands. We had those flip phones at best. And, you had this vision of a more connected environment and in delivering information and services at the point of care when it matters most. I mean, that's when the patient, you could argue, is the most engaged, right? They're just diagnosed. They're in a hospital setting. They really have nothing else to do but, twiddle their fingers. And, that's when you can actually capture their attention. And I think that makes really, really good sense. So a lot has changed in the past, 18 years, since your diagnosis, and you've seen an evolution happen where, things are becoming much more mobile, patients are becoming more engaged, they're being more proactive in healthcare management. What's the journey been like? I mean, what have you seen in terms of your growth and the shift in the way patients are engaging with their health?
Well, I guess, first of all, if you ever walked up a really, really steep hill with a 80-mile wind blowing at your face, so that's kind of how, the first, 10 years had gone. And I don't say that with a lack of, frankly, respect, because I have incredible admiration for those folks who actually run healthcare organizations. It is an incredibly complex world. You come from medicine. So I will tell you that this has been anything but, an overnight success. And we knew that. This was about, hey, listen, if we're going to get into healthcare, this is a change management game that we're in, and it's going to be a hard one, but man, will the late nights and early mornings be worthwhile. And so what we have seen over the years are really kind of, I think, two things coming together. One is the convergence of, I want to say, healthcare information technology and consumer technologies is finally coming together. Mm-hmm. And that convergence is a challenging one because the healthcare IT stuff has been historically kind of old tech, slow tech, or what have you. But now you're actually seeing the convergence of consumer technologies and healthcare IT coming together. And it's really created incredible opportunity to totally reframe how care is delivered and how care is received. And then the second thing we actually have seen is the regulatory environment has shifted dramatically, right? So when we first started the company, while patient engagement and patient experience mattered, it mattered in the context of hospital executives would be like bonus based on like a satisfaction survey score, right, from their patients. But today, in a value-based care model and accountable care organizations, it literally is imperative of providers to find a way to deliver better, more patient-centered care because ultimately they're taking on risk and they certainly have an incredible awareness. If we can't find a way to get patients to self-actualize and take more control of their own journey, there's no way for us to help them, if you will. And so we really have seen the combination of those two things create a dramatic shift. So to give a simple example, it took us 10 years to get 40 clients. It took us 4 more years to get 400 more. Right. So that's kind of what we're seeing, by way of the change and it's been a very exciting time for sure.
Yeah, and you certainly were driven by a mission, which I could argue that a lot of folks innovating in the space today aren't necessarily driven by that personal mission and passion, and they're dependent on the next round of fundraising for them versus actually trying to create a product and a solution that serves a need and creates an outcome. So it's one of those stories. It's a 20-year overnight success, right? I mean, it takes time. Healthcare just takes time to innovate, and you've had the vision that the marketplace needed to go this way, and eventually it caught up, and you hopped on that hockey curve, the hockey stick curve in growth, and it's great to hear. But the whole notion, you started off with providing services at the bedside in hospitals, and now we're moving more towards a remote, health-driven, mobile-driven environment. So how does now Get Well Network play into the fact that healthcare is now being delivered where the patient is, not necessarily in the hospital?
I tell you, it's a great question. And we were, I think, thoughtful at the same time as naive early on. But our strategy was, hey, in order to do this work well over time, we have to get into the guts of healthcare delivery. And historically, in this country and around the world, that has been kind of in a hospital setting. And so the painstaking, the quite literal blood, sweat, and tears, and we've shed all of those things many, many moons over, was about, hey, find your way, work your way, prove trust, earn trust your way into the guts of healthcare. When you get into the guts of healthcare, then you will have the foundation and, quite honestly, the opportunity to then kind of spread out, right? And so that's kind of what we ended up doing. So the fact that we are embedded, into a lot of these large provider organizations, like at the point of care in a hospital, has now given us, in many cases, the credibility and the right to now help them take care of people when they're not inside the hospital building, And so now if you saw like our R&D budgets, they have shifted dramatically, right, from inpatient work into mobile, as you'd expect them to, right? Because at the end of the day, we are very skilled at taking a highly captive moment. When we're in a hospital building, in a hospital room, we have 92% of our patients are engaging with Get Well Network. So you can imagine when you have that kind of captivity and that kind of engagement, there's incredible things you could do to enroll patients in programs, to get them signed up for digital coaching, all kinds of kind of things to teach them about medications that are discharged or what have you. Now today, in today's world, but we all know 99% of the time, they're back at home, they're at work, they're at school. And we have to find a way, how can we, on behalf of the providers, help keep a patient locked into their plan of care in a way where they feel like it's their own. And so we happen to call it, My Get Well Network or Get Well Go, and it's really kind of Get Well Network on the go. And so now, like, if you happen to be a new mom or you have heart failure or you have pediatric asthma, you are living, if you will, with Get Well Network digitally, just like you might be tracking your fantasy football team, you're actually tracking your own care. And so we do a ton of work like in that realm. And it's really exciting work to kind of go do. And the outcomes, they're early on this work, as you know, in the world. But man, it's exciting when you can help people kind of get locked in on their care.
Yeah, that really is exciting because it allows for that continuity of care versus just sort of focusing on the point of care. Do you find that patients, when they're in the hospital now, are they still turning on the TVs or are they flipping through their phones and utilizing purely a mobile environment?
It's a lot of both. So, when you're in the hospital, you're typically fairly acute. So you're not feeling really, really well, right? Mm-hmm. And so while it's easy to say, oh, let's just put everything up in the cloud, put it on their phones. But the reality of it is like, there are a lot of times they're laying in their beds around with their family members, and they might be just watching, quite honestly, a game, or the news or one of their favorite shows. And we've written technology that allows us to overlay content on top of TV programming to invite patients and families into their care. So picture somebody watching a rerun of Oprah, and their physicians inside of their electronic health record system, and they've just ordered a new medication for the patient. Well, we're picking that up as a trigger at Get Well Network, and we actually are saying to a patient according to their screen, hey, Michael, good evening. Your physician just prescribed prednisone for you. We actually want you to understand what the medication is and what you should know about it, right? Mm-hmm. And so I will tell you, like even today, while, of course, we're racing towards mobile and we're doing a lot of work on tablets inside the hospitals as well, this TV is an interesting opportunity for us, both in the hospital and in the homes, and will remain over time in parallel with mobility.
And so I'm just curious about the cost model around this, because at the end of the day, you've got to sort of demonstrate some sort of outcomes beyond pure satisfaction, right? Are you reducing readmissions? Are you improving adherence? Why it's great that we're educating patients, but why would a health system or a health network want to pay for a service like this?
Yeah. So look, as you know, the kind of value equation has two main components to it. One of them is cost, right? One of them is value delivering. So let me just touch on the costing for a second. So when we first started this business, we were literally installing big Dell Optiplex 745 computers on the walls, hooking them up to a TV monitor and trying to convert it to a desktop, right? It was very expensive, very heavy, very costly, not only from a deployment standpoint, but from a support standpoint, right? Now, today in the buildings, thankfully, there are iPads floating around. There are smart TVs on the wall. And so like with this technology, like we're just running an app, right? So number one, the total cost to deploy the solutions have become a lot less, which is terrific. And so it kind of makes the ROI hurdle lower, right? Just to begin with. Now, on the value side, the things you mentioned are exactly what we are monitoring, right? So we have a research institute here with incredibly skilled and experienced clinical statisticians. And so we are measuring all the time outcomes around readmission rates, around fall rates, around medication adherence, around hospital admissions, around satisfaction scores. And all of those things today in the provider world, as you know, impact reimbursement, right? And so the value proposition used to be somewhat, hey, we should do this because it's part of our mission and it's the right thing to do, to, hey, we better do this. It really means the sustainability of our business, So it's really been an interesting shift on that. And so we're fairly, I want to say, religious about the data. And so there's just a very heavy dose of kind of data analysis kind of going on today.
Yeah. I want to drill in a little bit around the art and science of patient engagement, because I think even if you talk to pharma companies today, they're like, the new blockbuster drug is patient engagement, right? How do we get them more engaged? And there's somewhat what I call the Fitbit paradox, right? The people who are utilizing device aren't the people who need it the most in the first place. And so how do you ultimately get, the least motivated patients to be engaged proactively in their care? I mean, have you guys done a lot of research or thinking around that?
Hey, listen, we have done a ton of research on this. So a couple of things, and I probably won't make a lot of friends with this first statement, but I guess I would tell you that we don't think that the now 269,000 healthcare apps on the app and Android stores are actually going to create sustainable change. So
yeah, I agree with you on that.
So we actually believe that this notion of inside out is really important. This notion of when you're a physician, the role of the clinician, physicians, nurses, care managers, care coordinators, whomever the case may be, their role in helping patients and families engage more effectively in their care, we don't think is ever going to go away. And so when you actually can develop technologies that kind of have that convergence of consumer health and consumer tech and health IT, and you can actually provision these solutions from the provider, we're watching exponentially bigger impact, influence, and sustainability when these things kind of come from the provider, right? And so in our model, it's not about, oh, what's the cool new diabetes app? It actually is, hey, does my care team, are they embracing technology? Are they helping me, just like they're prescribing a med, are they prescribing me a pathway that's digital that actually helps me follow along? And are they following along with me? So we're like, patient engagement is a team sport, full, and it will never change, we don't believe. And so if we can help dynamically build better teams around the patient with the patient as the quarterback, then we're seeing great change. So that's kind of how it is that we're viewing this whole thing. And we are spending a lot of time and resources doing hardcore multi-site clinical research studies to really figure out the efficacy, of these tools, not just ours, others as well, on care.
I had a recent conversation with Ruchika Fernandopoulos, who you may know as the founder of Iora Health. And they implemented something as part of their system, the health, I think it was called the health coach or the health navigator. Yep. Do you have a component of that as well that basically assists the patient along their care pathway to help them navigate and coach them along the way in terms of what they should be doing?
We do. So really on two levels. So one, like we're at this time kind of building almost like a virtual care coordinator. That's kind of what our solutions are, for the patient and family. But at the same time, though, we are developing tools for the actual provider-based, or in future, probably also payer-based kind of care coordination team. Because again, we think that this trusted relationship with the provider is a really important one. Not because they're our customers, but because to deliver great care, you need their skill, and so for us, like we are at the same time building a virtual care coordination and virtual care coach tool that actually is facing both the patient and the actual care navigator on the provider side. And that combination is where we're seeing the biggest impact on things like readmission, lowering overall costs, and even creating a better experience for the patient, to be honest.
So what's your take on digital engagement versus human engagement? Where's the balance between the two? Because I'm a believer that it's not a binary equation here. It's not like digital engagement is going to replace, we're going to have bots that essentially coach and so forth. I still think that there's a human element as part of this. How do you guys sort of create that hybrid? Or if you do, I'm not sure, that the hybrid approach to that type of care?
Yeah, so we do. So I think this from your practicing medicine. Like healthcare historically has been probably 80-20 one way, right? It's like human bodies, hence the expense, right? Like 80-20 has been like the natural formula, or the formula that's been over time and evolved. So we do actually see that formula almost reversing, right? But not reversing where it becomes 99-1, right? Or 100-0 to your point. So however, we are seeing significant pickup in efficiency, right? So picture right now, you've got a care manager who's managing a couple hundred patients with virtually no tools in a spreadsheet, right? And patients sitting out there with like a paper workbook on how to manage their diabetes, and so in Disease Management 1.0, as we saw these buildup of these massive call centers to try to kind of call these people and try to help them and take care of them and track them. In our world, you can imagine now, you've got these same 200 diabetes patients. You got half of them very effectively following digitally, maybe a third of them not doing so well, and maybe like 10% of them not doing it at all. And so, but now all of a sudden you've now empowered the care management organization to focus on those who need help, to understand the person's capacity to engage in their own self-care, and to tailor interventions according to that, right? So we just announced a couple of months ago this new, we call it PEI score. So picture like a FICA score for patient engagement. What is your capacity to engage in your own self-care? And based on that PEI score, I can probably put you on a digital coaching program, but you better visit me 4 times at home, right? So that's where we think. So I guess this notion of, if you think about precision engagement, so that's what we talk about here at Get Well Network. So the model is precision engagement. It's the analog to precision medicine. If we can understand a person's capacity to engage, then we actually will engage with them in a precise manner to meet them where they are, and the care will get better and more efficient. That's how we think about the world.
I love that. The precision engagement is the analog to precision medicine. I think that's exactly right. I'm just curious, what are you, as far as the attention of the patient, what are you competing against? Not like other companies, but are you competing against their ignorance? Are you competing against their lack of motivation? What's sort of the flip side? So you probably understand why patients choose to be engaged. Are there certain conditions or certain attributes of a patient that you could predict that they wouldn't be engaged?
So we, of course, like many others, are studying a lot of both macro and micro data, on this stuff. I would tell you just more qualitative, not to bore the listeners into sleep, but on a more qualitative standpoint, what we're seeing is a fundamental opportunity to shift the notion of, hey, I have diabetes or I have cancer, so here are my blood readings. And if you shift this to a notion of what do you want your health for, and begin to think about a more whole person health model, delivery model, right? So if we can interact with patients to help them articulate, first understand themselves better, more deeply, and have them articulate quite explicitly, what do I want my health for? I want to be here to make sure that my two girls, I can actually walk them down the aisle and be a grandfather to their children one day. That is the motivation. And if I can, then that's why I'm going to follow my med regimen, not because I had diabetes, right? So we are actually working very closely with a number of our client partners to bring upstream this notion of helping patients explore themselves, articulate what they want their health for, share it with their providers, that the whole relationship becomes deeper, quicker. And we're watching the impact of that really kind of change their willingness and their capability to adhere to meds over a 200-day period or an 800-day period or what have you. If that makes sense. So that's where we're seeing a lot of promise in that area.
Interesting. So you had mentioned earlier about sort of we're entering this era of convergence, which is sort of an optimal timing in terms of Get Well really taking off and having larger impact. And you've certainly seen over the past 17, 18 years, incredible amounts of changes of innovation that's occurred in our healthcare system, from the regulatory innovation, technology, and the list goes on and on. If you were to, and I know, I don't get into the game of prediction into the future, but if you were to sort of look at the next 20 years and looking at some of the trend lines in terms of mobility, remote care, artificial intelligence, these voice activated tools like Alexa and Google Home, what really excites you about the next 10, 20 years?
I think the biggest thing that excites me is just accessibility. Like whether it's the mundane, myself and my wife being frustrated we can't get an appointment with our pediatrician for our kids on the mundane side, or it's the non-mundane, which you have communities of people that have been grossly underserved by the healthcare system because they either are remote or they are poor or whatever the case may be. So the thing that excites me the most is you have an opportunity through convergence of these technologies that are getting less expensive and more accessible by the day, where patient access just explodes, right? The access to be able to access a capable clinician for the care of you and or your family or loved ones, I think it's going to explode. And so that to me is the most exciting part of, frankly, being in this field that is incredibly complex and in some cases mind-numbing to work in. But man, oh man, like the work that you do every single day, while intellectually and sometimes financially challenging, it is incredibly meaningful. The work you're doing is impacting your college roommate's son, your elderly mother or father, and frankly, communities that you might see on CNN. You actually can impact them. So that to me is where I think we're going to see the biggest breakthroughs. That these kind of technologies around voice control stuff, around telehealth stuff, around it really will increase significantly the access to great care around the world. And that's the most exciting part about it.
Yeah. Giving there's 1 billion people across the world who don't even have any access to any kind of healthcare facility or provider. I like some of the work that Raj Punjabi just was doing with Last Mile Health that he shared over at TED. So exciting stuff. I love the accessibility, portion and vision for the future. You had talked about earlier also, your first decade of running the business was kind of like going uphill at 80 miles an hour in your face. And you did a lot of things sort of learning on the job. You're really about driving and trying to solve pursue a mission from your personal experience. Looking back, knowing what you know now, would you have done anything differently?
Almost everything. No, it's funny. I get asked, relatively frequently now, and I'm honored to have an opportunity to work with some entrepreneurs, along the way here. And I certainly, my first thing out of my mouth, which couldn't be any more true, is I've probably made almost every mistake in the book. So if I can help you just by sharing openly things that we frankly assumed without direct input from our users and then blew up in our face, I can hopefully save you some pain, And so I tell you that the funny thing early on for us was we first developed this solution, as you can imagine, from my personal experience, which was that of a young, interested, curious, scared, but optimistic cancer patient. Mm-hmm. And so when we deployed our first solutions, number one, the nurses on the units were like throwing stuff at us because we did not actually develop it with them, with their voice in mind. And they're incredibly important to the success of what we actually do. We also didn't develop it with the IT crew in mind. So they actually wanted to kill us as well because they had so many things on their list to kind of go do. And we also didn't develop it with the families in mind initially, And so I'll tell you, I promise the last of the sad stories, but it's kind of 7 years into my Get Well Network journey. My wife and I had twin baby girls, and we lost my little Macy after 19 days to a diaphragmatic hernia downtown here at Children's in DC. What I learned from that experience was, of course, the redefinition of personal kind of pain and anguish. But professionally, what I learned is too often the patients that we're taking care of are too young or too old or too sick or too afraid or too medicated to be effectively engaged in the care. So you better darn well think, every time you think about patient engagement, you better think of patient and family engagement. So our jobs at the organization is, how can we, at every precious touch that we have with a patient going through a life-defining moment, how might we rapidly build a dynamic, personalized team around them? And the family caregivers are an exceptionally important part of the equation of doing this well. So, man, oh man, like we have learned so much through some of our assumptions. And the only way you know how to do this work is by actually doing it, and so we've learned a lot and changed a lot over time.
Yeah, I couldn't agree more. I think that we can't develop an effective system without taking into account the family and the caregivers. And a lot of my listeners know that. We're caretaking right now for my father who's got Alzheimer's, and it's a real struggle for the family and the caregivers as much as it is for the patient. And I think they need to have a seat at the table just as much as the patient does. And I think it's critical for many, many conditions. But this is what I love about you. You tell it like it is, right? You're a straight shooter. You've got a personal mission. So many great lessons learned over the course of time, which is why I think you were a huge value add to my course some years ago. Share with us at this point in time, what are some stats that you can share with Get Well Network? How many facilities are you in? How many patients do you cover, et cetera, et cetera?
Yeah. So we're probably in about 500 or so hospitals and probably about 300 or so clinics. So last year, for example, we had 4 million patients were admitted to a Get Well bed, and about 1.5 million patients came through a Get Well clinic. So we're starting to really have, quite honestly, the solutions be driven by a ton of data. So we're learning so rapidly, like what's working and what's not. And so everything from user design to content, to workflow, through when a patient has the most capacity to engage, we're learning so much. So those would be some of the kind of important statistics. And we're working in very, very large provider organizations, from Kaiser to Tenet to Ascension to Adventist, very large systems in the country, to a lot of academic health systems from Stanford to Wake Forest, University of Chicago. We're working in probably 25 out of the top 30 children's hospitals in the U.S. as well, which has been a thrill. We're working across 35 VA hospitals. We work in DOD, so lots of really complex organizations who are trying to deliver great care, and they know they have to do it differently on behalf of the patients. And we're just honored and blessed. We work with incredibly committed people, and it's been a really kind of challenging but amazingly fun run, to be honest with you.
It's amazing to see such great growth, and I'm so excited to hear that. So where do you go next? What's the next chapter for you and Get Well?
I'll tell you a couple of things that are just really exciting for us, just on two levels. On one is we have done our first deployments in the Middle East, so we actually are working in Riyadh, Saudi Arabia right now. We launched earlier this year. It's been an amazing learning and life experience to realize that all the way across the world, in a world where we typically in this country just see things on MSNBC or CNN or Fox News, these folks are struggling with a lot of the same things that we are. So we have made dear, trusted friends and partners in trying to make patient care better there as well. We're actually launching in UAE in Abu Dhabi actually later this year as well. So the first kind of thing we see this thing going is global. So we are finding that the hard work for 15 years when done thoughtfully, really translates, all over the place. So we are looking in an excited way towards really kind of global expansion and impact, over the next 5 to 10 years. We're really excited about. And secondly, you mentioned it earlier, it really is to work outside the walls of the buildings, So not when you're in a clinic, not when you're in an urgent care center, not when you're in a hospital, but what about helping me live my best life, through my health journey? And can we help people partner on that? Is where a lot of our R&D, a lot of our M&A activity, a lot of our new clients, we're asking us to help them manage populations, not just procedures, if you will, an episode. So it's been a really exciting time on that too.
Well, I look forward to tracking the journey ahead. And this might be a great point to segue into sort of the rapid fire Mad Lib fill in the blanks. So if you're up for it, we'll go ahead and jump right into those.
Let's make it happen.
All right. The first one for you. The best piece of advice I ever received was?
Oh, you know what, man? I think it's quite simple. I was told by a coach I worked with early on, an executive coach. He said, listen, make a list of the things you're avoiding, change avoidance list to freedom, and realize that those things you're avoiding, deal with them, because it's kind of tying up so much of your positive, productive, constructive, amazing energy that you won't believe how much you can accomplish if you actually do those things you're avoiding first.
Huh. I like that. That is a good piece of advice. All right, next one for you. I'm most curious about the habits, the mentality, the behavior of people who are at the very top of their craft. So a silly example is I got these crazy seats down at Verizon Center for the Wizards, and I take my little girls in there to see LeBron James. So we go an hour before the game, and we are watching the focus and the diligence with which he warms up, and the difference in the way that he focuses versus even the rest of these guys. So even at the top of the game, there's even another level. So I'm not curious. I'm obsessed with actually observing, studying, watching the behaviors of people at the very, very top, of their own respective worlds. Yeah. So like what ultimately makes them a breakthrough from anybody else? I you know what? To be honest, I'm actually fascinated and obsessed with the same thing. But what have you learned? Any patterns that you've uncovered? Well,
I would tell you, it is like there's just a visible sign of increased focus and commitment, and that's not earth shattering. But people always say, well, hey, you got to make sure you're relaxing and finding balance. I'm kind of like, yeah. I'm kind of more into like embracing the imbalance. Like this is life work. And so the thing I've learned through some of my own personal stuff is the most precious thing is time. And I'll tell you what, like I've not been put here to waste a minute of it. And I kind of see that in these folks that I'm actually observing is they feel like, hey, time is precious and I'm going to leave the best thing I can do for this world to say thank you is to literally be my very best and be committed at a level that usually others aren't, and the impact we can have is important.
Yeah. Yeah. So true. All right. Next one for you, Michael. Looking back, what would you tell your 20-year-old self?
So it's so funny. So I tell my little girls this all the time and they get so tired of me saying it, but I guess I would tell myself, look, the price of greatness is high, but man, oh man, like it's pursuit. Even if you never get there, its pursuit is the biggest gift that you can give to the world. So like, I really believe that. And so I probably annoy them to no end, leaving for school every day. But we remind ourselves of that often. And it is the pursuit of this, the taking of risks, the being okay with failing, the getting up 100 times. I tell my team all the time here, I honest to God have been in probably 26 to 2,800 hospitals, quote unquote, pitching our software. Mm-hmm. And think about it. 400 of them said yes. The rest said no. I am not daunted. Like the work is that important that we'll go back again and again and again. So the price of greatness is very, very high. I didn't know it back then. If I did know it back then, I'd be a lot further along in the impact that we can have than I am now. But man, oh man, it is such a worthwhile pursuit.
Yeah, the excitement is in the pursuit. So true. Yeah. All right, next one for you. If you had to write a book about yourself, essentially an autobiography, the title of the book would be?
This one's easy, man. I think it'd be something around the power and influence of gratitude. I learned something really powerful through my own cancer experience and losing a little baby girl. And that is if we can explicitly find gratitude in our lives, not even day to day, but kind of hour to hour, and be explicit with that, there is incredible power and influence in gratitude. There is first kind of power in ourselves to actually continue to strive to kind of make our imprint, even if it's tiny, on the world while we actually are here. And more importantly, certainly from a business standpoint, man, oh man, have I seen the power of gratitude and awareness of that and the expression of it. I've seen it be incredibly influential. So that's really what I would think to write about if I ever had the time and strength to go do it.
Yeah, and it's such an important thing and tip to remember, because we always get so wrapped up in the rat race that we forget to have gratitude for the things that we should have. So a good reminder for that. Thank you for that. Next one for you, 2 more. So if you could invite 3 people over for dinner, dead or alive, who would you invite and what would you want to talk about? So
here's the deal on this one. So first of all, I love these crazy entrepreneurs. So I probably invite Richard Branson over, right? Just because the level of what I see in him is the risk taking, but rooted in core values that are just unwavering, is like a really cool combination. So so I would have him at the table and kind of ask him to kind of hold court. And I've heard he does that really well. I never met him. So I'd probably have him. And then I literally would have my brother Scott, who actually is the CEO.
Well, we could probably try to make that meeting happen. We'll talk about it.
Cool, man. So I'd have my brother Scott, who happens to be the CEO of the Philadelphia 76ers. They've been on an interesting run the last 4 years, and many people who are sports fans know. But he is probably my best friend in the world. And I would have him there because while in different industries, we have lived very similar professional journeys just in our respective commitments and loyalty and push, for what we want to accomplish. And then lastly, man, I'd have my dad. I lost my dad to Parkinson's last year. It's really interesting. I had a really precious opportunity to have him near me the last 6 months, and my little girls and my wife. I kind of lived through his passing and watched him pass away with a level of anxiousness and unsettledness, about things that really left an imprint on me. So I wanted to have him there just to relish in the gratitude I actually have for him.
Yeah. Well, that's a great 3. Last question for you, Michael. So on this podcast, we like to celebrate what makes us unique, what makes us different. We call that being unusual. So how would you fill in the following blank? I'm unusual because every day something on my wardrobe is purple.
Now, So purple is our color here because we believe that. So purple is kind of the color of royals, right? And so if we can find a way to help what we do, treat patients as royalty every single day, will have an impact. So I'm unusual because every day it's whether it's a purple belt or something in my socks, or a full on purple shirt. That's probably makes me unusual and it's probably pretty annoying. But other than that, that's probably what I would say.
I love that. That's a great answer and a great closer. And it's always a delight to chat with you, Michael, and hear your story. And but before we wrap up the call, if those listening want to learn more about you, about Get Well Network, about anything else that you're working on, where would you direct them to go?
Oh, absolutely. Kind of come to getwellnetwork.com. We're also on Facebook, and of course, follow me on Twitter at GetWellCEO.
All right. Well, there you have it. Thank you for being on the show, Michael. Great talking to you.
True pleasure to be with you, man. Take care.
You too. Hi again. It's me, Dr. G. If you are still listening, I'm hoping it's because you enjoyed this podcast. If you would like to hear future episodes, you could really help me out by subscribing to the That's Unusual podcast on iTunes and leaving a review. It goes a long way in helping me get the word out from avid listeners like you. As a thank you, I will be selecting one new reviewer each week at random for a free private 15-minute phone conversation where you can ask me anything and get professional advice on your career or business to help you stand out and make a difference. Also, if you want to be notified of any future episodes, please visit that'sunusualpodcast.com and sign up to receive updates on new episode releases. Until next time, remember to always think unusual.